are continuing our series with Women's Care Florida. It's Women's Care Wednesday, and we are talking about how this month is Cancer Awareness Month. We have Dr. Endometrial back with us today, and we're talking about a cancer this morning, which I hate to say it, even as a woman, I had not heard a lot about. Doctor, tell us what this is, why people need to know about this.
Yes, so endometrial cancer actually is our #1 cancer in the GYN world, and it typically happens in postmenopausal women. The uterus is one organ, and the lining of the uterus that women normally shed with a period is called the endometrium. That could actually build up and develop into a cancer, and if not caught early, actually can spread and be very bad for a patient.
Yeah. So how on earth do we catch this? I mean, obviously cancers are, it's always best when we can prevent it and catch it early. Can you do that with this type of cancer?
So it typically presents extremely early on in the whole phase of the cancer. So women will present with bleeding when they're not supposed to. So if any female has bleeding, once they have gone into menopause, then that's a sign of potential precancerous or cancerous cells.
Is that the most common age that women typically are diagnosed with this?
Yes, so usually they're postmenopausal. However, younger women can be diagnosed with it as well. One of the biggest risk factors for endometrial cancer is actually being overweight. And so women that are overweight have extra estrogen that actually causes this cancer to form. So also women who are on hormone replacement therapy and it is only on estrogen and they have a uterus are at also increased risk for endometrial cancer.
Estrogen typically the hormone that kind of spurs this on? And
correct. And when somebody is overweight, you actually have extra estrogen that's being converted from other hormones circulating into the body from the fat cells. And so that, therefore, those patients have extra estrogen stimulating the uterus and creates the cancer. So it can also happen in younger patients. So in women that aren't in menopause, that are overweight, that have abnormal bleeding, then they actually should seek care as well because they could potentially have cancer of the endometrium.
Is it a test that you take? Do they have to go in and actually see an image of it?
Yeah, so we do a couple of things. Usually an ultrasound is done and we look at the lining on ultrasound. And then also we actually do biopsies in the office that will get those cells and diagnose it.
Cancer history in your family, does that factor into this?
So for endometrial cancer, it can. It's a rare number of patients that have genetic predisposition to endometrial cancer, about 10%, and they usually have a family history of colon cancer as well, and so they could be genetically tested, and those women are at extreme risk for endometrial cancer. It's up into like 50s to 60% of them will get the cancer diagnosis.
If you are tested for this, you have it, what are the chances that you recover well, and if you, you know?
So what's really nice also about endometrial cancer is the majority of the cases is cured alone by surgery, and that includes taking out the uterus, tubes and ovaries. We also sampled some lymph nodes. A lot of this can be done with what we call minimally invasive surgery, so small little incisions, so recovery is fairly quick.
What's your take home for women watching today, and certainly about this type of cancer?
So we can't prevent this cancer unless women lose weight, but we could actually diagnose it really early and cure it very easily with surgery alone. So it's really important if you're postmenopausal, you're having any kind of bleeding to seek care with your physician.
All right. Well, again, this is why we are so thankful that we have partnered with Women's Care Florida so we can get the word out about this. Thank you so much, Doctor. We appreciate your time. We know you're very busy. We'll let you get back to what you do best, and we'll make sure and put the info on our website. Thank you so much.